So today I'm going to be treating the hip using the Tecarpuls from Enraf Nonius. I'm going into piriformis syndrome, a popular treatment. It's preloading the heat at level 10, so the output, the intensity is at level 10. You want to go for about 1 minute per treatment head size, and so in this case I've come to 7 minutes. You'll see this now from the therapist's perspective. I've got the patient here. As you can see, this is left piriformis. So we're going to be treating left piriformis. I'll bring the earthing electrode in, just put a bit of contact medium on it. We can put this anywhere, but we'll just put this underneath the patient at the front. Piriformis syndrome is a very common problem. It's got various different names, had various different names over the years. Within piriformis, the sciatic nerve either comes out through piriformis or beneath piriformis. It's different in different people. It's very hard to tell which one any one individual is without cutting them open and finding out, and obviously we're not going to do that. I'll bring the thermal camera in here. If you have a look up at piriformis, you'll see there's not a lot of heat in there, 28-29 degrees. To find an area like piriformis where patients have pain and find that area is cool is not unusual at all. It's one of the signs often therapists look out for, is a cooling in the area. It happens in the neck as well. So we're going to bring some contact medium in, put it around the area that we're going to treat. So I've basically mapped out where I'm going with the contact medium. I want enough contact medium so that as it dries out during the treatment, I'm not going to be left with a sticky head. So as the contact medium dries out, the head will want to stick to the remaining contact medium. It makes it difficult to move. So I always put on a little bit more than I actually need. Don't worry about getting it on the towel. It won't cause any problems. It just washes straight off. So moving around here in small circles within piriformis, we're trying to build up the heat within the area. Obviously, starting off at a high level of intensity, it's very likely during the treatment the patient's going to ask you to turn the treatment down. It's perfectly fine. You'll probably find you get a hot spot. When you get those hot spots, they're just differences in the way the tissues absorb the RF energy and so generate heat. You can either avoid those areas. They can often become, when I've had it done, stingy painful is how I would describe it. They become painfully hot, so just turn it down. You'll see here I don't have my finger over the down button on the head, although that is very good practice. It's very common when you're first using the Tecar. If you have to turn it down, you'll stop moving the head, and then obviously heat builds very rapidly underneath the head. So it's good practice to keep your finger over the down button for when you need to turn it down if you're starting at a very high level. Another option is just to lift the head off the patient and turn it down, or alternatively just pause the treatment and turn it down. Now this is a long treatment, so I'm going to fast forward here to the end and let you see the heat map, see how it's built up. So back towards the end of the treatment, that's the treatment over. I'll bring the thermal camera back in and you'll see a surprising difference. As you can see there, piriformis is nicely warmed up, about 38 degrees, maybe 39 degrees at its max. Very good treatment.